Good morning, everyone, and happy Thursday. This is Rachel Burgess Burnett, Deputy Commissioner here, Children's Services Division.
And Tiffany Junkins, Manager of Family and Support Programs in the Children's Services Division.
And
Tom Rose, Program Development Coordinator, helping out with the second class of the webinar.
so we're happy to be with you today. We are just going to really give you some updates. I'm going to skip over a couple of slides just to get us started into it. And really, I just want to remind you, I'm just going to stop in really quick, stepping into some information. We do want to have some conversation with you about opening, but I'm just going to go through the slides, giving you some information, and then we'll do our Q&A. There will be a point in the conversation that I will see if I can get a couple of you open, just to give us some comments about how things are going. So we're going to walk through it. So let's go ahead and get started. And good morning, everyone. So this is a reminder that June, and we're almost at the end of the month, but June is Census Month here in Illinois. Just want to make sure that I'm reminding everyone that we still have time to meet the goal that our mayor has set for us here in Chicago. We are asking for many more people to still go online and get their census done. So please remind your parents, remind your families, remind yourselves, remind your community that we're still in the middle of what it is we're trying to do for the month of June here in Chicago, which is exceeding our goal. We always want to do better that we've set for ourselves. So please, again, here's the information. It's in the slide again. Please share and make sure that people are accessing the site. So I just want to thank you for all that you have done and all that you will do to get our census done. And again, a reminder that the number of people that are confirmed and completed in the census makes a difference for all of the funding that we have. And we really want to make sure that our families are represented. So please work with us and share the information, and let's get as many people in the system as we can. So again, we staggered our reopening, and again, a lot of the decisions to do that, again, we're on agency preparedness. Some of you have opened in the month of June. We have some that are opening in July, and we understood the reasons behind that. But again, it was about your preparedness and your having what you needed, both in making sure that your staff were prepared, also making sure that your facilities and sites were prepared, and that your parents had been communicated and were ready to come back. We did understand, again, about community impact. We do have some of the zip codes that are hardest hit in the Chicago area where some of you are located. And so we understand the need to think about when is the right time to open our facilities. And so we've been communicating with you, and we'll continue to do so through this. But again, staff availability was a big part of it. And one of the things I talked about before, and I will just reiterate again, it's about making sure that family and staff understand what it is that you're already doing within your facilities to offer them the healthiest and safest environment that you possibly can, and allaying some of their fears so that they feel comfortable coming back. And so just a reminder that the reopening plans were due to your DCFS licensing rep, and we were asking for copies to come to us. I thank everyone who's been submitting those, both to your licensing rep and to us, so that we have the documentation that's needed. We're reviewing them, and I just want to say, because I know I'm getting emails where people are asking if we're approving and saying when you can open. The approval is coming from DCFS licensing rep. For us, we're reviewing them to make sure that we've covered the bases, meaning the health and the safety, and you've thought about from the beginning or the opening of your organization, when you open your door, how you're going to do that, that you've thought through all of the varying processes that have been talked about in varying documents that we shared with you and other CDC guidelines and all of those. We've just been trying to review and make sure that we're meeting the standards for health and safety. But again, DCFS licensing reps are the ones that are approving it. Again, we wanted you to determine what dates you were going to reopen and then how many classrooms you were going to operate and what ages and groups, and we needed those numbers. And again, the numbers that we're asking for are the number of children that you're going to have center-based, meaning how many children are in each of the groups that you're opening. Again, we understand if you're just opening this month, did not operate as an emergency child care center, that your group sizes were 8 and 10. So we want to make sure that we are getting those numbers, we're capturing that information, and we're sharing that with our federal funder and states. Again, the second piece of that is you have families that you're still connected to, even if they're not in your center-based care. What we wanted to do was make sure that you understood that those families that you are working with remotely are still counting as enrolled families. They are still a part of your enrollment. I want to say what I've said in response to one of our delegates. When the governor made a decision to shut down childcare in the state of Illinois, we had a static enrollment number. Static enrollment meaning at the point of closure, we had all of your enrollment numbers for all of your sites. And we're reopening looking at those numbers. And so those are the numbers that we're looking at, but we understand your diminished capacity due to COVID-19. But again, we're still wanting to know that we're working with all of those families. And so as we're going through this, we just want to make sure that we have all of the information that we can. DCFS is now saying, resubmit your plan. You can open within 7 days. Approval is not necessary. Again, this is DCFS. Those are messages that are coming directly from them, from that other state agency. And we don't have any control over the messages that they're giving you. We're trying to keep up with it, Gwen, as much as you are on what it is that they're saying. And later in the slides, I'm going to give you also the update for the new licensing standard that also came out. But again, for us, knowing that we have agencies that are opening and reopening all the way some into July, we are trying to capture all of your numbers that you are reporting to us. And again, our numbers need to align to your enrollment that we had in March. So if you had 60 children and you're only serving 40 center-based, I would anticipate 20 of those children are still being served remote because you had 60 enrolled. That's what we're looking for when we're looking for numbers. And for any gaps that we have, we'll be coming back, but that's what we're looking for. I thank you for those of you who sent it to me. I just wanted to clarify it because I had a couple of questions on that information. So again, those of you who have partners, we need the exact same information. We are not connecting with your partners at that level. We need you to give us plans. Some of you have given us those detailed plans, but I'm reiterating the need again, because when we're capturing information on enrollment, it goes delegate with every one of your sites as an individual site, and we need their enrollment and their plan and their numbers as well in order for us to have our full enrollment information and data that needs to go back to our funder. If there's any questions that you have on any of this, please feel comfortable sending me an email so that I can clarify it. We are required to report to our funder every week or so. Our next report one is going out this afternoon as an update on some of our numbers, and so we'll be doing some of that and coming back to people if we need some other information. I'm going to answer a couple of questions as we go through this so that when we get to the bottom, we can do some of the other detail. And so Sharon is asking, how should remote learning be documented? I'm going to come back to you with how it should be documented in COPA. We're trying to build something that will allow us to do that. Right now, it's a number that I'm asking you to give to us when you're giving us your number of what you're operating this program year. We're trying to change a couple of things in COPA that will allow you to do that. One of the things that you were doing or agencies were doing, you were documented under case notes. I'd ask you to continue under case notes as we're trying to build out another place in COPA to capture the information. And we will come back to you as soon as we can finish working on that system. So should we mark out e-learning children who are, when you said, we're going to ask the question about what do you mean, Julie, when you say mark out? Due to DCFS number reduction present in COPA in our attendance book. We're going to come back to you. We're going to write the guidance and give you that information. I'm trying to get some, thank you for the clarification. Should we mark out, mark our e-learning children? Right now, I'm going to say this. I want you to capture that you are working with all of these families. Your staff are working with them, and my recommendation would be that you have a document where you're showing that these parents are being communicated with on a consistent basis as we work on our side in COPA, and then you'll be able to put that information in there. But right now, documentation should go into your case notes for the contacts that you're having with your parents. Who do we send the number to for e-learning? We've been running programming through e-learning since April. Those numbers, Kimberly, should come. And right now I'm going to ask you to send them to me, and I'm going to give them to the person. And you can also CC Victor Santiago, because he's also helping us build out the report that's going to our funders. And so yes, attendance or something needs to be documented daily for every child that's in your center-based program. As you know, you are with your remote learning. We recognize that you're not doing remote learning with them 5 days a week, but what is your cadence for working with them should be documented. Okay, so let's go back to the slide. Thanks, Tom. So again, if you're having any issues or concerns, please don't hesitate to contact us, because we want to clarify this. Excuse me. This is indeed a work in progress, and I hope everybody understands that. When we were first working with our federal funder, we didn't have permission to do remote learning. Now that we have permission to do remote learning, we went to COPA to see what could we document in COPA to help us with this. And so we're trying to work out a system that allows you to do it. But again, what I want to reiterate is you were doing it through these months since we've been closed. You've been doing remote learning. We want you to continue to do remote learning. We want you to continue to document it. And then we're going to give you information on the next side of that, which is when we have a COPA data entry access point for you. We will give you that as well. My reminder to you is your staff, children, and parents that are entering in your site that test positive, you do have to report that. Everybody needs to the one piece that I should have included in here is your DCFS licensing rep, as is in the document where they talk to you about setting up your reopening plan. They're asking you to reach out to your DCFS licensing rep. We're also asking you to let us know. We're trying to make sure that we track and understand where there's any positive COVID-19 cases. So we're asking that you also let us know that. So as of yesterday, we did get a new emergency rule on 407, filed emergency rule making on 407. This emergency rule is effective for the next 150 days. This is an active link. If, we will make sure you get this. This is an active link. You can go in and you can pull this down. It's also on the OECD website, but you will be able to click on this active link here and get directly to the emergency rule. The second one is Restore Illinois Daycare, and this is guidance. It's a supplement to the licensing rule. And so I do recommend that you have both of those and that you pull both and have both of them accessible, and that your staff who are working with your licensing and working to make sure that you're meeting all the guidelines, that you have both of these available and accessible. Making sure that you keep up with it. Again, notice that this one is good for 150 days, which means there's going to be another rule. So we do need to continue to keep up with the different rule changes as they come and the different things that are we're being told that are new and or different regarding the things that we need to do within child care in the state of Illinois. One of the things I did want to point out that we did here is the extension for required immunizations has expired as we are reopening child care. So what we're asking you to do is make sure that you're talking to your parents and making sure that they're going back, talking to their pediatricians, getting their appointments, your family support staff working with them, or whoever your staff are that's working with them to make sure that they're able to get their immunizations up to date, that right now has expired. I will say that I know there's some advocacy out there in the state of Illinois, because we also recognize some of the difficulty that parents are having. But I just want to make sure that you understand that the extension that we had through COVID-19 thus far, that extension did expire. So you do need to be talking to your parents about getting their updated physicals with immunizations so that you can have that documented. So a couple of enhanced procedures, I just want to pull it out again. In your reopening plans, the kind of things that we've been looking for were that you were following the guidance on making sure that you were talking about how often and what you were doing to clean, and that you were following the guidelines about high-touch surfaces and those kinds of things, that you had thought about the fact that in order to keep the environment clean, that you were understanding that certain toys you could not use, soft toys you could not have. You can have things that you could clean, that you can wipe and clean, but you can't have things in classrooms that you cannot do that with. I had in a previous one talk to you about, please do yourselves a favor and declutter your classroom. Get things out of the way. As children are returning, the fewer things that they have access to are the fewer things that you have to do this with. And so I'm hoping that many of you took heed to that, get some of those things out of your classrooms so that they are not causing conflict. One of the things that we recognize in reopening childcare is this: children are children. They're going to touch, move, and constantly come in contact with things which we know is going to be very, very difficult for your teachers. So we understand what all of this means when you're opening up group settings. But again, it's the recognition that the keeping 6 feet apart, making sure that you were doing plated meals, making sure that you had all of these things thought through before you opened were the kinds of things we were looking for. Again, we are not the ones that are saying that your reopening plan is approved. I didn't want you to have to do 2 plans. I did not want you to have to do one for DCFS and then do a separate one for DFSS if what you were giving to DCFS was meeting what we needed. And after going through the guidance, it was meeting what we needed on our side. So we were only requiring that you give us a copy of your reopening plan so that we would have that on file. So again, I thank you to those of you who have done so. If we have not received them, please do so. We do need to have those on file. So one of the things I do want to give you an update on, and I'm going to let Tiffany talk a little bit about this, so I'm going to turn it over to her.
Yeah, thank you, Rachel. So we recently found out that we got a donation of child masks that are reusable masks. And so we put a survey out yesterday to be able to get information from you. And so what I need you to be able to do is complete that survey as soon as possible, right? And in the survey, what I'm asking for every delegate to do is identify the person who's going to be responsible for a mask pickup. It's for children's masks, and this is going to be offered to all of our delegates. The donation was enough to make sure that every child gets one, and we need you to identify in the survey your delegate agency's name, email, and a contact phone number for the person who's going to be responsible for picking these masks up. I don't need an office number. I need a number where I can actually contact somebody. So if that's a cell phone number, that's better, or a place where we can actually get in touch with someone. There will be a central distribution location, and we're going to have that place be the United Center. And so just kind of understanding your proximity to the United Center, I need to make sure that you're going to go ahead and identify the person who can be responsible for coming to the centralized location, and they're going to be doing a pickup for all of your children. So whether you have one site, multiple sites, okay, I need you to go ahead and identify who this person is who's going to do the pickup for your agency, okay? And so we really need you to get on it today and complete that survey. If you have any questions, if you didn't get the link that we sent out yesterday, please give me a call. We're going to be closing the survey within 24 hours of it being published. So at the end of today, that survey will be closed. But we want to make sure that we get your information of who that person can be who can actually pick up those masks. The date of distribution is to be determined, but it is PPE, and so we're trying to make sure that we get this information and get these materials in your hand as soon as possible. There's going to be some literature that we're going to include with these masks that we want you to post at your facility. And, it's all about safety and precaution. And so as much information as we can have about social distancing, about wearing masks and things like that to try and keep us safe, we want to make sure that we're doing that and we're getting that information in the right hands. So just expect that with the mask, we'll also be giving you information as well.
And so one of the things that I didn't hear Tiffany say, and she may have said it, these are cloth masks that you're receiving. Again, these are children's masks, and they are cloth masks. And so it's based on the number of children that we see that you have enrolled, is how we're giving the numbers to the agencies that have donated them. And again, they will be packaged based on the agency and based on the information we're giving them. They're doing this at the distribution site, and it is imperative that we get the information from you on who's the pickup person, because that individual will be the only person who can actually retrieve this on your behalf. It is that detailed of information that we have to give them. So again, thanks for those of you who have responded. Please, if you have not, that will close. And then we will build from that our list so that we can get this to the distribution site so that they can begin packaging this. And then we will come back and give you information on the date that you will be able to pick them up. Any donation that we get, we're hoping we get more. We're going to do the same thing, and that's turning it around and getting it into your hands.
Linda, you mentioned that you tried to complete the survey and wasn't able to access it. One of the things I'm going to be looking for to see if we have an entry for you already, because if somebody's trying to do double entry on an agency, then you would get an error in that respect. But if that's not the case, I want to look into this a little bit more. Send me an email, because after this meeting, I want to be able to look into this, okay? We want to make sure that we're capturing your information as well. Thank you, Linda.
And so, Cindy, the answer to your question, I hope I answered it when I said it's based on your enrollment. It's for your children, and that's the number that you're getting. And remember, mass are for children 2 and up, so it's for your any child, and I just want to say this for the larger group, it's for children 2 and up that we're looking at the numbers, or 3 and up, I'm sorry. For the mass that we're getting is 3 and up. And so that's the mass, and that's the number, and that's how we're categorizing it as we're pulling this list together. Just to note, a few days in, some of the reusable masks have already been stained and don't wash out. We need to replace them from time to time. Yes, and that's why we're trying to get donated items so that we can help you in this. And so we understood we had people who were opening. We understand that masks are only good for so long. And so the moment that there was an opportunity for us to do this, we jumped on it so that we can get these out there to you. And we're trying to get these out as quickly as possible. Once we were told that we had the access, they launched the survey. We're trying to get it in. We're trying to get this information to our contacts who's working with United Center. We want to turn this around as quickly as possible so that you'll have some new and clean ones coming to you. We don't have any adult masks right now. If we get access to any, we will. What we have is the child ones right now. We're looking into other ways, but we're still working on it. Let me just say that right now. Can you resend out the surveys? Little hands didn't get it. Let us get through the webinar, and Tiffany will be able to talk to the staff to figure out what's going on.
Yeah, and if you didn't get it, can you send me an email? Because I need to know that maybe you're not a part of the listserv for our CSD update. And so it went out in the CSD update. But my email address is Tiffany, traditional spelling, Tissany, .Junkins, Junkins, @thecityofchicago.org. Send me an email that way. And Tom, can you type it in as well, my email address? We'll type it in the chat. But send me an email, because I want to make sure that we're capturing your information.
So I understand the suggestion of 2 people, but I'm going to tell you that because of restrictions going into the building, they're only allowing us to give them 1 contact person. So if that contact person isn't able to do it, we might have to do something as an alternative, but they will only allow us to give them 1 contact person per agency to do this pickup. That was one of the questions that has already been posed. So again, whoever you're giving us needs to be the person who you trust that will be able to do this pickup in the next few days, because we're trying to get these turned around. But I can't put 2 names on it. The document won't even allow me to do that. There will be parking. They will be able to come in. They will be able to get their pickup. Everything will be understood, and you'll get directions on all of this. Once we can get this list together, we have a cover page. They're going to give us the directions. You will get the date and all of the instructions you need in order to do your pickup.
There's a question about parking at the United Center. And so for this particular event, the parking will be free. This is something that we're doing. We're working with our city partners, and so you will have access to parking at the United Center.
So can we change the contact person if they will not be the ones to pick up the mask? Yes, if you need to make a change, you need to send Tiffany an email, because we need the correct person on that list. Okay? Thanks, Julie. And so I'm going to go ahead and just say we sent out information, and I will say right now, the training for Trauma Informed, I've got a July 15th date. If the 14th is confirmed, I will send it back out. But right now, please, on your calendars, mark July 15th for Trauma Informed. We want to make sure that all of our delegates, we understand, and I want to make sure that we're talking a little bit about the why behind all of this. I want to make sure that everybody understands two things. Number one, we recognize that as we're bringing families back, as your staff are coming back, and as you're just simply opening, that this is traumatic. And which means that people who are already going through all of what they're going through as far as being out there, going through everything they're going through with their own families, that there's trauma. And so one of the things that we've put together, and we have a presenter who's going to do this for us, to be able to say to us that they're able to do a training on behalf of our community of delegates and giving you information to help you with your staff and also with your families, because we're concerned and understand what we are doing as we're opening up our new sites. And those who have already opened, I'm going to give you a chance in a moment if you want to share anything, but we want to talk about the fact that we are doing everything that we can to understand what this is and trying to support as much as we can. When we got the opportunity to get child masks, we wanted to make sure that we could turn those around as quickly as possible. We want to get them in your hands, and we'll continue to do everything on our side. I'm going to let Tiffany talk about the next item.
Yeah, so we wanted to talk about, and as you're reopening your programs, making sure that things like parent handbooks are being updated. We understand that there's a lot of policy changes, at each one of our centers, and we need to make sure that we're changing policies, but we're informing those who need to know, right? And so making sure that parents are up to date on what those changes are, and I would even suggest that there's an acknowledgement form that you can have them sign, but something, that they acknowledge what these new policies are, these rules that they're going to be expected to follow, and that sort of thing. We want to make sure that that information is happening. And so for those who have reopened, hopefully, this is something that you've already experienced, but for those who have yet to open, that this is, just one of those reminders that we want to make sure as you're in the process of getting ready that staff, parents, that they all understand, right, what these new rules are, and that there's some type of an acknowledgement of the new rules. Our next Executive Director, Program Director stakeholder meeting, it will be July the 9th, and we plan on doing that as far as a virtual webinar again. By then, according to the information that we have, all of our centers will be open by that time. And so it will be interesting to get more information on how things are going at your respective sites and at their respective locations. One of the things, because I know there's been a lot of kind of comments in the chat about PPE, as we talked about masks, I do want to let you guys know, because as the city of Chicago, we were trying to procure a large order of PPE on your behalf. And trying to make the large procurement, the marketplace, it just didn't exist for the volume that we were trying to order. So we talked with our senior executive team about putting funds in our contracts, because we did get federal CARES dollars to be able to support these efforts. And so I do want to let you know that that's something that you can expect to come your way. We've been told by our funder, our federal funder, that CARES Act funding can go back to expenses that you incurred, right, from January to November. And so I do want you to kind of think about that as you're kind of thinking about how you can use these funds. So even things that you've done to prepare yourself, anything that's going to be COVID related, in preparation for reopening of your spaces and things like that. If you had to go out and secure your own PPE, those are the types of things that you would be able to use your CARES funding for. But we're in the process now of trying to make sure that those funds go out in contracts, because it took us so long to be able to get the PPE that was going to be required on a large scale, just because it was difficult in the marketplace. They just didn't exist, the volume that we were trying to procure. I think Eva had mentioned one of the comments about reusable and cloth masks, and how just trying to keep up with them being clean and et cetera. So one of the things we were really trying to do was secure over a million, I think it was 1.5 that we were trying to procure as far as disposable masks, because we understand that in the child care setting, those disposable masks are really what you want to procure and trying to keep your spaces clean. But as it stands, we're going to go ahead and move toward putting the funds in your contract. So just know that that's coming. We're in the process of trying to work that out for you. But there will be more information to come.
What other questions do we have?
All right, so we do want to hear from you. And I don't know if anyone is interested in telling us about how your reopening went. If you could go ahead and put some comments in the chat, that way we could go ahead and share out. And we're trying to look at the questions.
Tiffany just talked a little bit about the funding and our getting dollars out to you through your delegate contracts, Julie. So I know Tiffany just talked about that. Will there be funding for PFA-PI delegate budgets as well? Right now, I will tell you that we don't have access to dollars. We are working internally to see what we can do. We're trying to do everything that we can to assist across all of our funded programs and looking at how we might be able to ensure. That's why for us getting the donation and being able to get those out as quickly as possible, it's across everyone, and we'll continue to do that as much as we can. We're looking internally right now to see what we might be able to do as far as support across our state-funded programs that are state-funded only. We are working on that.
Yeah, I do want to just say, though, we went to our funders, for early childhood block grant, and they didn't get any CARES funds to be able to pass to us for our PFA and PI programs. So I don't want you to think that it's out there and we're just not providing it. We just don't have the funds for the PFA and PI. So we're trying to think about those solutions that we can come up with that we're still able to assist PFA and PI as well. What we did get was about approximately $11 million in CARES funding for our federal grants, and that's across Head Start, Early Head Start Child Care Partnership, and Early Head Start Expansion. And so we are looking to put most of those funds in contract, and that's forthcoming.
So I'm going to answer a question, and then I'm going to actually unmute a couple of you and just let you talk to us. And the question is, can we clarify when and what contract the CARES funds will go? These are federal dollars, and so the CARES Act dollars will be attached to federal grants. And so Head Start, Early Head Start, Early Head Start CCP, Early Head Start Expansion would be the contract that CARES dollars would be attached to. So I do see that we have, let's see, Lisa Gwynn. If you say yes in the chat, then we can get you open and let you talk to us about your reopening. You said things had gone well. Same thing I see for It Takes a Village. I saw that there was a comment there that it had gone well as well, and we can unmute you and let you talk to us. Julie, again, I see you. If you let us know, I'm gonna, Lisa, you're unmuted. Can you hear us?
Yes, can you hear me?
You sure can. Hi. You know what? I'm just gonna say this for a moment. It is really, I'm really happy right now because we've been doing these and talking and not hearing voices, but we really wanted to stop doing it that way. So thank you for agreeing to let us unmute you. So go ahead and talk to us about how things are going.
Yes, thank you. Thank you for the opportunity. We opened on Monday and it has gone really, really well. So we had a lot of anxiety and of course concerns, but once we saw the children coming back in and under our new safety procedures, it made it all worth it. And the children have been the best part of reopening. The classrooms have been so peaceful, of course, because they're down to 10 classrooms of 10. And so they're getting all this wonderful individualized attention. I think our biggest learning curve is just implementing so many new cleaning procedures and making sure we have the PPE and supplies needed. But we have a lot of checklists and we have a whole handbook to guide us, and we just keep going back to that and going in with the mentality that everything is new, everything is different, but the children and families we serve remain the same and as excited as ever to be back in care. So it's been really, really wonderful.
Great. Thanks for sharing. Thank you for that. Zuli, can we unmute you? Hi, Zuli, can you hear us?
Yeah, I can. How you doing?
I'm doing good. Great to hear your voice.
Same here. Well, I can hear your voice, but glad you can hear me. But
Yes,
things are going well. We opened up Monday also. Just some things that have worked for us. For those who haven't opened, is having designated pickup and drop-off times. Very helpful in maintaining the social distancing of 6 feet instead of risking parents converging at the door at the same time. Just make sure your policies are clear and make sure, you talk to parents about what will happen if they're not following policies and procedures, how it can be a danger and risky for children and staff and themselves. But the thing that's working for us, we also went over to a touchless sign-in system. So they can sign in and actually sign with their signature on their phone. And that's been helpful too. We're trying to really just go as touchless as possible.
Great.
So those things that are helpful. And if you aren't open, you may want to consider.
Great. Thanks, Zuli. I'm glad to hear things are going well. Thank you. Gwendolyn Harris, can we unmute you? Yeah, I see the questions. I'm going to come back to that. So I'm going to go back to Lisa. I think Lisa mentioned touchless sign-in, and people are asking about that. I'm going to go back and just ask you to unmute her. Lisa Gwen. Lisa, do you mind sharing a little bit? We got people asking about how did you do your, what software and how did you do your touchless sign-in?
No, we are not the center doing touchless. It's the other, yeah.
Okay, sorry about that. Go back to Zuli.
So I contracted with ProCare Connect.
ProCare, thank you.
There is a ProCare system that is more intense and more expensive. You don't need that one to do what we're doing. It does a lot. ProCare Connect does a lot, and it will cover probably all of your needs, and it's a little less expensive, but it is wonderful. I don't know how we live without it, quite honestly. It's wonderful.
Okay, thank you. Everybody, it was ProCare Connect, and thank you, Zuli, for sharing that. Can you unmute Tasia Evans? Hi, good morning.
Hi, everyone. Just bear with me. I did have my tooth pulled, but things are going well. It takes a village. We opened up on June 15th. We have Head Start and we have Early Head Start. So 2 separate buildings. On average, we've been having between 40 and 50 children. Our process is touchless also. Once the parent and the child arrives, we take the child's temperature, we put it on the log, we ask the parent that dropped off to pick up their name, and we write it for them so that they're not touching anything. Things have been running really, really smoothly. Our parents seem to understand our policies and procedures. We covered them. We had a parent meeting the week before we opened via Zoom, and we gave them all the information that was needed. We can see daily that our teachers are sanitizing even more to keep our groups the same. The children are here from 8 to 5. We have teachers that come at 7:30 to 4:30, and the other teachers from 8:30 to 5:30, which gives them 30 minutes to do any type of sanitizing that wasn't done the night before. And also the closing person is able to prepare for the opener in the morning.
Thank you. Thank you. Glad to hear things are going great. Thank you. All righty. So I see a question from Cindy. Can COPA have that function like a scanner? We have had a walkthrough with some additional functions that are in COPA with our vendor. And so again, as I was mentioning about having something in there where you can actually document children that you're doing remotely, we are walking through it to see what other pieces of COPA we might be able to open up. Of course, we'd have to, get everything out there, train you guys, but that's what we're trying to do, is to see what we might be able to do with and for you in the COPA system that you currently have access to. Thanks for asking that question, Cindy.
Yeah, absolutely. And so, as Rachel had mentioned, we've kind of done a walkthrough with the developer. Before anything hits production, we do have to do testing to make sure that the plan can be executed, and then, of course, training for all delegates. So that is something that we are looking to do, and as soon as we're able to roll out that, that type of an enhancement, we definitely want to make sure that it reaches everyone. But that's a great question. Thank you, Cindy.
Heidi, can we unmute you? Heidi, you're there talking about teddy bear. While we were waiting, because I'm trying to get you to respond, I don't want to just unmute you. I want you to let me know that it's okay for us to do that. While we're waiting to see, I know I'd asked Sharon and I've just asked Heidi if we can. I do want to point out one thing that Ken McGee has put into the chat box. What he has said is that that they are able to give you additional information on accessing PPE. He has some information that he can share. That's Ken McGee. We can make sure that we get his contact information back out there. I think most of you have it, but we can send it out to make sure that everybody has Ken's access so that you can get information on additional PPE. And yes, Ken, COPA does have the swipe card functionality, and that's what we're investigating with them right now. So thanks for sharing that as well. Heidi said yes. Can go ahead. Heidi, can you hear us?
Yes.
Hi.
Hi, can you hear me?
Yes, we can.
Hi, good morning. It's great to hear all of you.
Thank you.
So I just want to say thank you for everything, all the support through all of this, first of all. It's great that, we do have partners to do all this and that we're all working together. I think it's a great thing. Teddy Bear, we've been open for 2 weeks now, all of our sites, and they're doing well. Yes, it's been a process, but all of our staff are working very closely together, and our parents are communicating very well with us. And we do still have some children on e-learning, that's obvious. Our DCFS reps have been working very closely with us. Actually, right before this webinar, we had a meeting by phone with our rep, and she was, giving us the guidance to move to the next, phase with the more children. So, we also use Smart Care. So we've been communicating with the parents through that way, either via of email or text. And the kids are responding very well, wearing their mask, and things are going good so far.
Great. Glad to hear that. Glad to hear it.
Yep. So thank you.
Oh, thank you. Thank you. The question, Cindy, you're asking about meals. We will have to follow up with CPS about how long they're going to continue and what they will be doing as far as meals. I will say that, and I'm going to say this to all of you, these are your families, and you are definitely within your right as far as working with your vendor and your food vendor. If you're serving 20 kids in the classroom and they are able to do 10 meals for kids that can be picked up for the other 10, you're well within your right to have that be a process that you can do internally. I know some agencies have been doing meals for families through their vendors. And so again, it's an opportunity to still do that with and for your families. But yes, we will have a conversation. We don't know the answer to your question about will CPS continue to offer. We will find out if that's something that they're going to be doing going forward. And I know what you're asking for is for the fall. I will say that they've just gotten their guidance on opening in the fall. So they're at the table, just like we're here talking about our reopening. They're now at the table talking about opening for the fall. So they just got their guidance. ISBE just put their guidance out again and talking about opening school programs in the fall. Don Delgado is asking, can anyone of you who have opened, can you share any information on social distancing in your classrooms? And so anyone who feels that they can answer some of that, if you can just say yes, we'll mute you so that you can share how social distancing is working in your program. Lisa is saying yes, so unmute Lisa for me. Thank you. Hi, Lisa. Thank you.
Hi, yes. And so prior to opening, teachers did several Zoom sessions and all virtual lessons for children, using social stories for social distancing. They created some cute little songs to make it a little simpler and some motions to show how you could put your hands out kind of like an airplane, and sets for like 2-year-olds and up, and teach social distancing. And it has worked really, really well. And then we just made our first this first week all about this new space that we're living in. So there's many great social stories on Teachers Pay Teachers that are printable. And so using them in the classroom and also sending home copies of that kind of information to families has worked really, really well. And because there are less children in each classroom space, the social distancing is a little bit easier. Of course, children still play next to each other occasionally and, those kinds of things. And teachers have also placed social distancing markers in the classrooms, but child-friendly, like you would see out in stores and things, on the floors for lineup. And children have adapted to it very, very quickly and love the little songs and the stories. And so that's just, children are much more adaptable than adults sometimes, I think. So it's worked out really well.
Thanks, Lisa. While I have you, Lisa, do you have any information you could share about children wearing masks? That's another question that someone has.
Yeah, and so we were skeptical about how it would be for children to wear masks as well, and especially because feedback from families prior to opening was, my child doesn't like to wear a mask. I don't think they're going to wear it. They won't wear it at home. But that's another thing where children have just done really, really well, and their parents are so surprised. And of course, so many of their masks are, cute little characters on them. And even seeing teachers in masks has not been a problem. Children like seeing what the teachers have on their masks. And again, we use social stories. And prior to opening, we would show, we did Zoom sessions and virtual videos of their teachers with the mask and showing the mask and putting a mask on like a doll, making it very normal and natural. And in the classroom, it has gone better than we expected.
Great, thank you for that.
Yeah, I think that's great, Lisa, especially when you're talking about how the teachers, because they're modeling it for the children. The children look up to the teachers, being that adult in the classroom, and they do want to emulate, what their teacher is doing. And so if they're making a mask look cool, then absolutely, I could definitely send them one and to make sure they have on one too. Absolutely.
Yeah, and even like in their drawings now, we're even seeing like in the art center, they're putting masks on their drawings of themselves, and so it's becoming the new normal. But like children kind of lead the way in that sometimes, and so that's just been really wonderful to see.
Absolutely. Thank you for sharing. If we could leave the world to children, we'd all be better, right?
Exactly.
Thank you. Thank you. Julie, can I unmute you? I want you to talk a little bit about, you mentioned, and I agree with you, the Sesame Street COVID-19 town halls and stories are really great. Can we unmute you to talk a little bit about what you've done? Thanks, Julie.
Hey there. So you already said it. I was just typing in the notes that the Sesame Street COVID-19 town hall is absolutely phenomenal. And children have their own questions afterwards. And it's really a great icebreaker to introduce the children to these new concepts. And I highly recommend not dancing around the proper terms, but instead teaching them the proper terms. COVID-19, social distancing, 6 feet. A fun way that you could introduce the 6 feet concept is using a noodle, the noodles that you swim with, just to give a physical demonstration on how far apart you should be, and just using constant anecdotals all throughout the day. One of my teachers had the children sitting at the table, and she said, "Oh, I want to come sit with you guys. Should I sit right here?" And she pointed to a chair next to a child. He said, "No." And she said, "Well, why not? You're too close to me. You're too close to me. Social distance, social distance." And she said, "Well, what chair should I sit in?" And they pointed to the one all the way at the other end of the table. So the more that you drive it home and use the proper terminology and make it fun, like hand washing has become the new in thing. They want to wash their hands all day. That's awesome. They get to shoot the paper towel into the garbage like a basketball, and we keep score after they're done. We keep score for proper washing techniques. So they're really doing a great job, and they're teaching the adults at home what they should be doing, and they report back if they see something that wasn't quite right.
Great. Thanks a lot for that, Julie. Thank you.
Mm-hmm.
I'm going to respond to a question, and it is, want to confirm that it's okay for our staff to sign children in and out on the sign-in sheet to reduce contact. And I'm going to respond and say right now, my answer to you is yes, because we do want to limit contact. One of the things that we were asking was to say to parents they could bring their own pen, so nobody was sharing pens. So there are different ways for you to do that. Again, as many contactless ways we can do this, the better for you and the environment, for the families, and for the children. So we normally say that, and I just want to say we're living in a new normal. This is not what we would normally do, and you would not hear me give you that guidance under normal circumstances. But right now, as we're trying to protect, I'm going to ask you to, just like you're doing, other people are using software that's allowing contactless ways to get children in, then I want you to think about what ways you might be able to do that as well. I hope my response was helpful.
Yeah, I think it was helpful too, so Rachel, and just thinking about that, as kind of being one of those flexibilities that we're allowing programs to do, just making sure, just with everything else, that, if that is going to be embedded in your program, that, parents and staff, that everybody understands what the new expectation is. And, maybe it's hard for us to put a timeline on it right now.
One moment, I'm sorry. So your license, let me, and I will always defer back because the licensing rep and they have to come in. I see that Farrah is saying that the DCFS licensing rep is still saying that the parents had to sign themselves in, and that's what we were going back and forth trying to get them to tell us that definitively. And so if you have a rep that has said that to you, Farrah, thanks for chiming in, because we were not getting that from them because we were still going through this, as you know. But I thank you for chiming in at this point and saying that we have licensing reps out there that are saying that parents have to sign themselves in and out, which legally they should. I'm going to tell you they should. So let's work on, and to your point, Jovan, I'm going to come back and say, because if one licensing rep is saying it, I will tell you that within their communication, others will too. So again, if you can have multiple pens available and making sure that you can have a parent bring in theirs, and you can do everything that you can to make sure that you are doing everything you can to be contactless, I'm advising you to do that. And thank you again, Farrah, for jumping in on that, because we do want to make sure that we're following it. I don't want to give you any guidance that trips you up. And I guess someone's saying that they're sanitizing pens, and I say sanitize, and sanitize, wipe them off, make sure again, any way that you can do this to make this work so that you're not having other issues on the other side. Can we please, and I'm going to come back to your PPE questions in a moment, Julie, but we put a container for used pens that need to be sanitized. And again, what this sounds like to me is just like in an infant room where you have toys that can't be shared between, that they go into a container, they're sanitized before they go back into use. Thank you for sharing that, Megan. That's a very good way to think about doing it. You have one place for those that need to be cleaned, one place for those who have been cleaned that can be used. Thanks for sharing that. Great idea. And so, Julie, you're asking specific questions about the amount that you will be getting for PPE. I will tell you that, go ahead.
I'm working on it, but let me say this to give you a ballpark. In my plan, it's about $320 a child, okay, for PPE. We're going to earmark other things, though, within that, okay, that can all be spent on the supply line. So it won't be just $320. But just to let you know, when you say PPE, what I have earmarked is $320 a child. So at least that gives you something to be able to work with now, as you're already incurring expenses, okay? But we will get all of that information rolled out to you guys, what you can spend on a supply line, because it will wind up being more than just that, based on how we did the budget, okay?
And it will, and again, I see what you're saying, Julie. It is a little more than that of what you're hearing from Tiffany saying. She's saying specifically to just PPE, but there will be a supply line that you will get where you can spend money on PPE and other items that will be in that supply line. So it will be more than the 300 that she just said. She said specifically just on PPE, but your supply line will be more than that. So that's what you're going to be getting, and that's what we want to clarify for you. Okay? So let me just ask, and I'll pause for a second to see if there's anyone else out there who'd like to share. We've tried to respond to questions as we've gone through this. If there's anyone else who wants to be unmuted, we'll give you an opportunity to do so. And so I'm just going to wait a moment and see if we get anyone else who'd like to add anything to the conversation this morning. And in advance of that, I want to thank everyone who allowed us to unmute you and talk to us this morning. I will say while I'm waiting to see if anyone else says yes, that as of yesterday, we had 71 of our sites that had opened across Chicago in the first few weeks of June. So I thank all of you for everything that you've done in getting yourselves open, getting things ready, welcoming back your staff, welcoming back your families, and all of what you've done to make people feel safe in these environments, because we understand that was part of what the concerns were, and you're jumping on and putting together policies, procedures, and guidance. And you know, and I love doing Zoom meetings with children and having them think about what it is. And again, the first week of coming back under COVID-19 is the same as coming back to the new school year. You got to start all over from scratch. You got to make sure that all of your children are thinking about this new normal and all the new things that are now being required of them. You know, I love the stretching the arms out and showing them the distance and, you know, testing for knowledge. You know, one of the things where, you know, a teacher says, can I sit next to you? And the kid says no. So, you know, I'm listening to all of that. It's making my day to hear about what children are doing and how it's working for all of you out there. And we'll continue to do this, giving people an opportunity to share how it's going, because, again, we learn best from each other.
Yeah, this was great. I think Linda kind of captured it too, that, you know what, I think sharing as a community of learners, because this is something that we all had to adapt and pivot and, you know, make changes. It's great being able to hear from others on what they're doing. How can we best go ahead and use what we've learned in order to go ahead and develop new policies and procedures and implement them well? You know, what's working, what's not working. And we will be in that kind of that constant, thinking about how do we reframe to go ahead and make sure that we're creating a safe environment for all.
So thanks for that comment. You know, we're working hard. The team on this side has really been working hard. We've wanted nothing but success for all of you, and working with our funder to make sure that they understand and are reminding them how large Chicago is, making sure that they understand the impact of COVID-19. And how we needed to do this and how we needed to do this safely. So thanks for acknowledging that, and I will make sure that the staff that are not in this room get your message as well. So thank you for acknowledging that. So I do want to go to your question, Cindy, and you're asking about home visiting. What I will say is we have not given guidance about doing in-person home visits. We're asking that you continue to do them remotely. Right now, what we're trying to do, again, is keeping your staff and the family safe, and that is not going to the doors of homes yet until we get into a phase where we are together, and this is all of the home visiting programs are talking together, McD, PI home visiting, early Head Start home visiting. We're all talking together to make sure that we're thinking this through and giving the best guidance. And we all agree that right now, in-person home visits is not something that we're ready to do. We need to continue to do them remotely until further notice. When we get further down, knowing how we are able to move forward with COVID-19, diminishing numbers, looking at incidents and rates in communities, I think we will then start talking about reopening and doing home visits in person, but that's not something we're talking about doing right now. We are going through these months and over this time period until we have better data that gives us this an okay for your home visitors to be out and about in community. We're not going to go there yet. We're waiting until we get better data. Once we get it, we'll come back to you, and we will then have some specific conversations about home visiting, just as we have had about doing care within centers, because we, again, will want to make sure that we have the right guidance for your home visitors as they're getting in their vehicles, driving to homes, getting out of their cars, and going into these environments, because we'll want them to be as safe as they possibly can as well.
And just an extension of that, we've received questions too about group socialization. So, you know, we want you to understand that, you know, we're adapting to our new environment. And so socializations can happen in a virtual setting. And so we encourage you to do that. We're hoping that you're doing that. And if you are, please continue to do that. I think that it's a good way to connect and make sure that others are connecting in the group. It's going to be different. But you can still make that socialization happen remotely.
All right, thanks. I've waited to see if anyone else raised their hand, and right now I'm going to say thank you to everybody who's chimed in and shared and given information. Again, I think we learn best from each other. You lightened my day and, gave me some things to smile about, so I thank you. I thank you, and I thank you for that. I thank you for your comments, thanking us on our side. We're here for you. We're here to support you. That's our job. That's what we are here to do every day. And, when we can do more, we do more. Sometimes we don't end up with the ability to do as much more as we want to do, but we definitely want to make sure that we're giving to you things that are going to help you on the other side. So I do see another question. 3 to 5 use of disposable, is it okay for now? Everything disposable is okay for now. Right now. And again, what we're saying is this: if you have a kitchen and you have the ability to do plated meals on your plate and clean, sanitize all of those in your classroom, that's okay for us to do that. I will check Monique to make sure that ISBE, who has also agreed that you're doing plated meals and that you're not doing family style, won't have an issue with disposable items. And so I will come back to you on that one. We were asking for guidance on it, and it was a little up in the air, so I will ask for clarity, and I will come back and give you a definitive response to that. But I will say, if that's the only way to serve a plated meal, we have to serve plated meals. We cannot serve family style right now because, again, everything that we're doing is going to be voided if we're trying to do it the other way. And another one says, we were just notified by our team supervisor oh yeah, I know. We did have a resignation on our team. Kelly has resigned, and it will take us some time for a replacement. But what we will do internally is whenever someone resigns, their work transitions off to another individual, we'll get back to you and let you know exactly who that person is that will be working with you going forward. So yes. Thank you for saying that the cohorts have been helpful. We're really happy to hear that was good. Ken, there's a comment in the box. If you can't say it, if you can't see it, I'm going to repeat it. The ECBD cohort support has been helpful. And I want to thank Ken and his team and everything that they've been doing on behalf of all of you out there through these cohorts and trying to help you think through some of this. And he's been searching for and coming up with some great information that he's been sharing. So I thank you, Ken, and I thank you for that comment. And so I'm just really glad to hear that. So you're responding, Ken. Thank you. More kudos to you, Ken. So again, thank you, thank you. So it's a few minutes after 11. I think we've responded to your questions. I see one just came up, so I'm going to hold us here for a few more minutes to see if any other questions come in so that we can finish off on those, and then we're going to let everybody have the rest of their day. And so disinfection spray is so hard to find. If you have any responses, and I'm going to give you my response to it. And this is my response to all of you, and I should have said this earlier because I responded to a question to someone else. And this is what my response is. In childcare, what licensing has said and what we've been doing for years is bleach solution. That's right. So I'm going to go back and I'm going to remind everyone bleach solution, because the bleach solution is the best thing, both the CDC guidance and everyone, to us being able to disinfect and kill viruses. And so making that bleach solution as required in the morning and having staff use your bleach solution is the best thing you can do. Disinfection spray, all of those things are very hard to obtain. But if we just go backwards and we defer back to what has always worked in childcare settings, and it works in healthcare settings as well. This is what's used, and this is what I'm recommending that everybody continue to use. The question I got from someone was about, they can't find Lysol wipes. And my response to them was, I understand you can't find them. No one can, except for the federal government. I was watching a news media, and they all had a large container. So I figured out where they all are. That's a joke. But my point with this is this. We need to go to what it is that we've always used. It's really kept our environment safe, and that's the bleach solution. And so I'm encouraging all of you to continue to have your staff every day make up and use what we know that fights viruses, which is that bleach solution. So I'm going to say, Cindy, I know it's hard to find. My answer to your question and my resolve for that is the bleach solution that we should be using every day.
There was a question about, since Kelly is gone, who do I reach out to? And so program operations is led by our wonderful Bee and also Elaine. So Bee is our director. You can reach out to her. You can also reach out to Elaine Millsap-Parker, who is the assistant director. Those will be useful resources until we give you guidance on how that's going to roll out.
Yep. And so the staff need to understand it better. If what we can do, and when we send out information, I have a document on the bleach solution. I'll make sure that goes back out again, because I think everybody needs to understand how to make it, and it's only good for the day. It needs to be poured out at the end of the day, but we need to make sure that we're using it, because that's the best thing that we have, the best solution. So we'll send that information out again. Mask wearing is 2-year-olds and older. Yes, Jackie, we do have that written in the guidance, and we will be talking about that a little bit more, so you're absolutely right. And what it says is 2 years if they are able to, because again, some 2-year-old children are not able to keep that mask on, and so where it is conducive, then yes, 2-year-olds can wear them. So I think we've gone through the questions. I haven't seen any other hands raised, so it is 11:10. What I'm going to say is, everybody, please, I see Anya put something in there. Go back for one.
Thank you, Anya. Anya said you can follow the directions on the bleach container itself, and it'll tell you how to go ahead and mix the solution properly.
Yes. Thanks, Anya. So again, I'm just going to go ahead and give you back some more time in your day. I want to thank you, thank you, thank you. Thank you for all that you're doing. Thank you for the plans that we've received and the plans we will receive for those who have not sent them in. We need them so that we can finalize all of our information for our funder. I do have still gaps in my document that's going out today because I don't have reopening dates from some of you. And so I do have staff following up, trying to get that information from you if we don't have it, because we do need to have dates for all of our sites so that we know. Staff will be following up and checking in to see how you're doing. But one thing I want to remind everybody, we're here. We're here in support of you. If there's anything that you need, please don't hesitate to reach out and let us know what that is. Again, one of the things that Tiffany's talked about, we are working internally. We did get one document from HHS with an amount for the CARES Act dollars, and then we got another directive. Don't use that number, which stalled us in our process because we were told not to use that number. They did come back and they gave us another number, and to our delight, it was higher than what we had. And so now we're at the table making sure that we've looked at everything and we're able to allocate the dollars at the appropriate level. And so we're working internally with our fiscal team and our contracts team to turn this around on your behalf. But in the interim, again, there is a supply of children's fabric masks that we want picked up. In order to do so, we need people, if you've not responded to the survey, to do so. If you're having problems with it, please email Tiffany. And again, I just say thank you, thank you, thank you. I'm really glad to hear things are going well out there as we're reopening childcare. And I will just say, because I lean on it all the time, and I'm just going to say back to all of you, if we could turn all of this over to children, our world would just be so much better. And it's a delight to hear just how well things are going. And children are back, the smiles are on their faces, and the staff are enjoying it. There was one other comment in there that I do want to end with as we talk about this, and it was about how do we help staff? And we help staff by helping them understand that you've really thought this process out, that we didn't open up the door or didn't think about going back in and opening up childcare without thinking about them as well, and making sure that the environment that they're coming back into has been well thought out, that it's safe, that it's a safe environment, that their health and safety is being taken into consideration. One of the things I want you to think about is making sure that you've updated your personnel policy so that they understand that if they're sick, what you're saying to them is they need to stay home. And we need to make sure that we're following that, because having ill staff and programs isn't going to help you. So thinking about how you write all of that, thinking about how you communicate all of that, thinking about how you stay in touch with people who still have that angst in their fear and their gut. And I want to say to you, this has been really impactful, what's happening out here with COVID-19. And I have a hard time talking about it without tearing up, because I've been impacted 3 times in my family and very close friends in just a few months. And it's been one directly after the other, directly after the other. And I will tell you, your families and your staff are going through the exact same thing. This is hard, people. This is hard work where we're asking people to do. And so I want everyone to please be mindful of what it is that your staff are going through, just as you do that with your families, and just talk to them. One of the things that we're offering you is trauma-informed care training, and that's one of the reasons that we're doing this. What I said to our region, I'm concerned about our reopening childcare with everything going on. And I would be remiss if I closed this and did not talk about, it's not just COVID-19. In our community, everything is just turned over. We went from COVID-19 to deaths of more Black men in community and the acknowledgement of death of a Black woman in community. Maybe not in our state, but it's all the same. It's felt just as hard here. And we've got people who are trying to find their place in America right now. Children are hearing this. Staff are going through this. Parents are going through this. This is very difficult. There's nothing I could say that's going to ease a teacher for you. But what I want you to do is acknowledge that you understand that this is difficult and this is hard, and that you're willing to work with them through their angst and through their anxiety. I advise you and your staff to be on that trauma-informed training, to get some information and some other key points that you can share and help your staff. And if you've got staff, give them the Zoom link and let them take the training. I want everybody who needs to access it. We requested to have a trainer who does trauma-informed training do this for this exact reason, because of everything that we know our children and families and staff are going through. So please take us up on the offer to do this, please. I'm going to also send out another link to all of you today, because between now and the end of the month, there's another free resource. So please check your emails before I leave today. I'm going to send you another link, and it is about helping yourself and helping your staff as they're thinking through and going through all of what you're asking them to do now. And so as many resources that we can find, we're going to be sharing those as well. But we're all in this together. We are all in this together. And we just want this to be the safest environment for every one of our children and families, and for you and your staff, that we can possibly have in Chicago. That's why it took us time to get here. That's why you've never heard me say you must open, because I wanted you to think about your families. I wanted you to think about your staff, and I just wanted you to do it in the method and in the system that you knew worked best for you and your children and in your community. And so I thank you for everything that you've done. And I will, when I can, when it's okay, because it's not yet, I'll be out to visit. But again, not until I can do it, and I can do it safely. And then you can welcome me in. I need to see children. This has been a very difficult time, and I just want to see those faces. I want to see those smiles, and I want to hear the giggles. So again, I thank you for everything. We're here. If there's anything we can do for anybody, please don't hesitate. And with that, I say have a great afternoon. Enjoy the rest of your day, and we'll talk to you soon. Thanks, everyone.